And we're back on this Tuesday edition of your coffee break on the HAN network. As we mentioned earlier, April is National Occupational Therapy Month, and we have a special guest joining us today from Griffin Hospital, a return guest, occupational therapist Leslie Prescott. Leslie, welcome back.
Well, thank you for having me back. It's a pleasure to be here.
Yeah, it's great to have you. And we should say, Leslie, tell us first a little bit about occupational therapy and how it can help people.
Occupational therapy is the only profession who we help people across the lifespan to live their fullest life the way they want to do things they want to do and what they need to do using therapeutic activities of daily living. We encourage people to live life to the fullest, to do what they want, and also to prevent illness and to either live better with illness or with injury. The common occupational therapy intervention, it includes, and it's not really limited to, activity of daily living retraining, and we also work with low vision, we also work with orthopedic rehabilitation, and we also work with upper extremities and splinting making.
Wow, and so this could be really life-changing for somebody just kind of relearning these skills, right?
Absolutely.
And do you feel like all the people that need this help are getting it, or do you think maybe they're hesitant to go out there looking for it?
Oh, basically, we receive referrals from their primary care providers, or sometimes from an orthopedic doctor, or a low vision ophthalmologist, or any type of specialist. They know about occupational therapy, and they know how we help people regain and to restore function.
That's great. And I know you brought along a lot of stuff for us to check out. So what are some of the things we have here?
As I mentioned before, we work on custom splinting. So let's say that we have a person come in with arthritis, they're having a lot of joint pain and having a lot of swelling in their hands. We would evaluate them and give them like a compression glove to help with edema management. And another thing with arthritis is very important to protect the joint, okay? And that's gonna help the patient recover as they, I put it on the right way, it's gonna help the patient recover, and they can engage in their daily activity without aggravating the joint. Joint protection is very important to restore function. And as I mentioned, I didn't mention before, we also work with people recovering from stroke. And the main concern we have as occupational therapists is that they have one side weakness, and sometimes their muscles might kick in and they might have high tone, and they might start posturing their fingers in a flexion. And we don't want to promote deformity, we want to restore function, we want to minimize the tone as they recover. So we would, even in the acute setting in the hospital, we would get a consult to make a custom splint, and we would fabricate the splint on the patient just to put the patient in a more functional position to minimize the tone and to restore function.
Wow. And now I know we have a guinea pig here, Eric Gendron, who is going to take some tests for us. Can you explain what Eric's going to be doing for us?
Well, Eric, today is Occupational Therapy Month, and we're talking about strength and dexterity. So I am going to test Eric's grip strength using a dynamometer, okay? Now, it's a hydraulic system, so basically you're not going to feel any spring back on it, but I'm going to ask you to press as hard as you can. It's going to test your force, okay? So are you right or left-handed?
Right.
Okay, so just for today, I'm just going to test his dominant hand. Okay, so your position is great. So what I need for you to do is put your elbow at 90 degrees. I want your forearm at neutral, your wrist at neutral. Relax your shoulder. Hold that position, and then what I'm going to do, I'm going to come in front, if that's okay.
Yes.
And I'm going to have you squeeze it 3 times. I want you to squeeze as hard as you can. Squeeze as hard as you can. Okay, good. Very good.
That's hard.
Really strong. Okay, so
nice.
you got 65 pounds. Okay, I'm going to have you do it again, Eric. Squeeze as hard as you can. Good. Okay, we got 60 pounds.
And this is based on his age, right?
This is
so
based
he's going
on
to do it
his
3
age.
times. Okay.
So he's going to do it 3 times, and what I do is I add it up, and I take the average, and I'll tell him where he's at with his age. Squeeze.
Then we find out how much of a weakling I am.
Yeah. Good job. Squeeze, squeeze, squeeze. Good. And relax. So we got 61 pounds.
61, okay.
Okay, so Eric, I have to add it up and I'll let you know.
And we'll see how you're doing. So
See if
Eric's
I-
28 years old, going to be
28
29
years
soon.
old.
So in just a few days.
Oh no.
Oh
Eric,
no, it's not looking
I don't
good,
know.
Eric.
Let me just add it up. Oh boy.
I think you did a good job.
Yeah.
It looked hard.
Okay. Oh, what am I doing? Okay, 60 plus 65 plus 61.
And you have this, so I just want to mention on your chart, you have it from age 20 to 24 all the way to 75 plus. So you have quite a range of things to check.
Okay, Eric. Right now, we're looking at your age range for someone who's 28 years old for a man, for a right-hand man, is supposed to be 120 pounds. Okay, you're a little bit, sorry.
So what can he do to it? Is there any way to improve that?
Absolutely.
So how does
Eric.
he improve that?
Well, what you can do is you can go to your primary doctor and you can ask for an occupational therapy evaluation and treat, and we can work on some strengthening skills and work on some functional things to make you a little bit more stronger.
That's right. And you know, I do have to say, we do a lot of physical work. He's one of our directors, and so he is lugging things around. So I'm surprised, Eric, that you didn't
Yeah.
perform so well, but it's
Maybe
all
you're
right.
held back a little bit. Yeah.
But Leslie, I know now this month is significant. Every Tuesday, that's starting today, there's going to be programs at Griffin Hospital, informational sessions. Can you tell us a little bit about those?
Right. Today, Tuesday, just as I demonstrated today with Eric, we're having dexterity and strength.
Great.
So we're going to have this dynamometer there, and people get to see how strong their grip strength is and other activities to test your strength. And that's today. It's in Griffin Hospital, right in front of the cafeteria. And basically, we're going to provide information. It's from noon to 1. And then next Tuesday is every Tuesday in April. So next Tuesday the 12th, we're going to talk about managing osteoarthritis. We're going to have a lot more devices there, like this is a jar opener. We're going to show things like a built-up spoon just to alleviate the pain in your joints, and also active range of motion exercises to help with the healing. And Tuesday, April 19th, you're going to see me there for low vision.
Right, which we've talked about before on this show.
Yes, we talked about it. I didn't have this last time, but we have like a LED light handheld magnifier and different type of adaptive devices that we train people with low vision to use so they can see better and function better. And Tuesday, the last Tuesday of this month, we're going to have stroke education. And again, we'll have devices like this custom splint and a lot of other tools that we use to facilitate recovery.
That's great. Now, Leslie, would you have to say it's changing people's lives? Just these adaptive devices can really make a
Absolutely.
difference.
Absolutely. Adaptive devices, relearning ADLs, retraining, and also, which is activities of daily living, also therapeutic exercises to make you stronger.
That's great. And if people want more information on the programs, where can they go?
Well, they can contact us at 203-732-7445 or griffinhealth.org.
All right. Thank you so much, Leslie, again
you.
for joining us. We really
Thank
appreciate
you for
it.
having me back. I appreciate